Hello and welcome to Healthcare Champions. Today we are talking all about joint replacement. I can't think of a better person to talk to about it than Dr. Philip Clifford, and as your patients call you, Flip. I love that. So Flip, welcome to the show. You're with Outpatient Joint Replacement Center of America. Welcome.
Thank you so much. Appreciate being here.
Give me the lowdown on you. How long have you been practicing?
Been in practice initially up in North Carolina for about 20 years. We started working on an outpatient joint program when my PA came from New Jersey and joined me in North Carolina and brought with her a lot of information about doing outpatients. And by outpatient, we mean actually having the surgery done in the morning and actually theoretically going home within about 6 hours, sometimes 4 hours, and being in your own bed that evening.
Wow, that's incredible, because outpatient, and I think with a joint replacement, certainly like a hip replacement, I automatically think, oh, okay, outpatient, 23 hours. You're talking about legitimately the same day. Wow, that's
Exactly.
incredible.
And that's the reaction that most patients have. They don't even know that this is a possibility. And once they find out about it, they want to know more, they want to learn more, and just about everybody would love to be able to do it. About 70% of the population who needs a joint replacement can actually have it done as an outpatient very safely.
Wow. So the other 30%, it's usually a medical reason why they can't?
Correct. And those folks need to be in a hospital in order to have their medical problems monitored and watched, typically overnight for one night or two. Occasionally, patient selection also has to do with whether or not that patient has enough support at home. So sometimes it's a social reason why they can't have the surgery. Yet every patient can benefit from the rapid mobilization protocol that we use, which is very unique and part of what we bring to the table that's very special.
And that's something that you guys have come up with. And do you have a real quick explanation of what that is?
Oh gosh, it involves a mixture of drugs and interventions associated with how we get patients ready for surgery. Sometimes there are medicines we start before surgery. Some are very specific doses of medicines given during the surgery that helps to decrease the narcotics that are required with the surgery. Some medications actually decrease bleeding. Some of them actually numb up the joint for up to 3 hours. And by decreasing the amount of opiates or narcotics that are needed, which obviously everyone knows from what's been in the literature, this is a big issue right now in our country, we're actually decreasing the likelihood of patients developing an opiate problem later.
That's fantastic. In addition to that, you get them up and moving quickly, really doing amazing things over there. Same day joint replacement.
It's pretty amazing.
So let's talk about that. For some people to hear those words, I can only imagine my doctor saying to me, Shelley, you need hip replacement. What? It almost gives me goosebumps thinking about it. That can be a very scary thing. I don't even know where I would go. How would I even begin to wrap my brain around that, much less what doctor do I see, what's the procedure, and there's so much information about it. I may see one doctor that says, oh, you definitely need a hip replacement. I may see another one that says, you're fine with cortisone injections. What do you say to those patients? Or maybe those patients that have had thousands of cortisone shots and don't know what to do.
Well, our team sits down with patients when they come in, and we basically have an open discussion about what the options are, and understanding those options and then understanding the likelihood of each of those helping you is what it's all about. Some patients who have bone-on-bone arthritis have been sold regenerative medicine options, which are very unlikely to help them, where patients who have less arthritis and a more normal-looking joint can definitely potentially benefit from regenerative medicine, which we also offer through our clinic. So there are many options that are out there as potentials. Understanding and us taking the time with the patient to help them understand what the choices are is what's really key.
Okay, so talk to that person. If there's someone out there that's been given different information and they're a little confused, do you guys advocate second opinions? I mean, would you help that person out?
Absolutely.
At least clarify some things?
We not only will see those folks and sit down and talk to them about what their options are, we'll also see folks who have been somewhere else and had a joint replaced and they're hurting and they're not sure what's going on and they've not been left with many options. We're happy to see them as well.
But Flip, as your patients call you, let me tell you at home, I don't want anybody going, oh my gosh, he's a doctor. So Dr. Flip, tell me, that's part of what makes you guys unique though, the team aspect, and talk a little bit about that for a sec.
It's top to bottom. It's the fact that a patient reaches out to us online or calls in and they get Jimmy on the phone and then they walk in and there's Jimmy. So that concept of warmth that we bring to the table, myself, Maddie, and the whole crew, Kim and Matt, I don't want to leave anybody out. We're all about family. We're all about treating you right, and honestly, that's what it's all about, and that's what everybody in medicine should be all about.
Well, I really get the genuine feel from you. It's very clear that you're passionate about what you do. I've met your teammates there from the office as well. It's an overall feeling of just happiness and almost like family. Really is. So I know our patients out there, they're thinking, okay, tell me, how do I get a hold of Dr. Philip Clifford? How do they do that?
Well, we have our website's ojrca.com. We are located very centrally in the Tampa Bay area in Rocky Point. Look forward to hearing from you.